So I'll now open for the panelists. I'll give opportunity to everyone. Everyone will be given opportunity. So yes, we can start from, who will start? You? Nutrition, you can start.
Yes, there was an interesting question here regarding fullness and cereals. May I have the gentleman who asked the question? Yeah, okay. So, in fact, just now I was talking to Dr. Kohli and talking about how eating the vegetables and fruits in the right way can alter not only your health in other ways, but also alters your appetite and your palate. And particularly when you eat most of your fruits and vegetables, not in a dead form. I can use this word today because it's been used in its absolutely live, native form, which is uncooked. I am not saying don't cook, but I'm saying that do have a certain good amount of a significant percentage of the vegetables and fruits in its most native form, in the raw form, and you will realize how it alters your and which is why I said carrots, cucumbers, tomatoes. That's a simple. When I say salad to my patients, they get very hassled because somehow Indians are not salad people. We are not known to be associated with salads, and it seems alien. So all I have to tell them is, I want you to consume a carrot, a cucumber, and a tomato daily. That's your challenge. And that's the most important part of your diet. And the first thing I'm here is when the first follow-up is, actually, we didn't feel hungry. So you can actually go on auto mode, on auto regulation, if you're trying to lose weight, because your body doesn't want anymore. So that element of fullness, I think, seems to be answered with that. And your next question is regarding gluten, and this is the first time a public forum I am going to be talking about gluten as a question from the audience. So I think it's really happening. Awareness is growing, and this will take me a few minutes to explain, because gluten is a toxic protein, is a protein found in wheat, barley, and some other European grains. And in our context, it's essentially wheat and barley, and oats to some extent. Why this protein is being villainized is two reasons. One is what we have, what we call celiac disease. Celiac disease is something which is known for a long time. It's not new. Except the manifestations of celiac disease are very different from what medical doctors and textbooks have recorded all these years, what they have learned. Celiac disease is where the protein in wheat, gluten, destroys the intestines, causing malabsorption, and several other maladies associated now with it, including maybe digestive or extra-intestinal. So you may have celiac disease and you may have no constipation, no diarrhea, no acidity, but you may have skin manifestations, hair loss, autoimmune problems, psychiatric problems, schizophrenia, bipolar, depression, you name it. So a lot of work is now going on in this area, and we are finding in textbooks it is recorded as a childhood diarrheal disease. However, the average age of diagnosis of celiac disease is now 40 to 45 years. So it's an adult disease now. So several neurological problems are being associated with it, and I am working very closely in this area. We founded the first Celiac Society in 2006. It's a national society now, Celiac Society of India, and largely to create awareness about this disease. However, I have a little more to talk about what we call non-celiac gluten intolerance, which is not celiac. It doesn't destroy the villi of the intestines, but it causes inflammation in the body. And it behaves in terms of its manifestations just like celiac disease. So it could be right from anemia or iron deficiency or vitamin deficiencies to inflammatory conditions, to arthritis, to osteoporosis, osteopenia, anything and everything from head to toe. And that is a grave, I'm seeing a lot of people like this today, including affecting obesity. So there are a lot of links, and I think I have authored a book, Is Wheat Killing You? It's by Penguin. If you want to know more, you can read about it.
Thank you very much. Thank you. You can discuss during lunchtime for more tech.
Is following a trajectory which is actually unique. And this unique aspect is that leaves out all the discussion in the media about who eats what kinds of meat. But we are the only large country which is largely vegetarian. There is no other population of comparable size which has such a large component of vegetarians. The last NSS data available says that only 24% of Indians reported themselves to be meat eating. Okay? So the kind of industrial production of grains that you have seen in the developed economies of North America, later even Europe, Latin America, and most recently in China, that's unlikely to be seen in India. China grows 500 million tons of grain themselves. They import another 200 for a population which is more or less equal to ours. We are barely able to handle around 270, 275 million tons of grain. Why is that? Because our grain is not going into conversion into animal protein. And if I may stick my neck out, it is unlikely to do so in the foreseeable future. It takes 10 kg of grain to convert into 1 kg of beef. It takes 5 kg of grain to convert into 1 kg of pork. Now, aside from the politics, around 80% of the population of the country being Hindu, we are very unlikely to become major beef eaters. Fact, 15% of the population is Muslim, they are unlikely to become major pork eaters. So we are not going to be able to have the same conversion requirements that we've seen in the developed economies and more recently in China. And that is why fruits and vegetables are so important in our country. No other country has to deal with these volumes and deliver it to such a large population. Okay? So comparisons with France, Israel, etc., I of course very respectfully listen to them. I've had the privilege of visiting these countries, but we are just talking of a completely different scale. And that brings me to my third point, that all this being true, and we are the second largest producer of fruits and vegetables, we are also, in terms of the size of our production and population, the world's most wasteful and most inefficient handler of this fresh produce, which is a great shame, given the levels of malnutrition and given some of the issues that this report has thrown up. So now, this is the context in which I think knowledge like this has to be treated. It is just not one more report to be added to some shelf. I think ICRIER has done a great job, and my former colleague, the Horticulture Commissioner, has left, but I think we need to find ways to take this knowledge not just to government for policy making, we need to take it out to the population, because unless there is a demand for better regulation, demand for better standards, it's not going to happen. We were speaking in the morning, Pavinesh and I, now that's not relevant to the discussion, but one of the things that I'm hoping to do with my time, now that I'm out of government, is to promote a startup addressing the delivery of fresh produce to large urban centers like Delhi. And I've, for my sins in my career, spent most of my time in food and agriculture, and I have spoken to every major retail chain of this country. How is it that we can crack every logistics challenge? We can handle the most perishable of all agri-commodities, which is milk, okay? We can bring fresh milk to a place like Delhi, sourced yesterday morning from Gujarat. We can take the most critical medicines, and this is a cold chain developed entirely by the private sector, from remote parts, from factories in Bangalore to remote parts of the Northeast. We can deliver those vaccine or those critical medicine. How is it that we've not been able to do this for what we are consuming at least twice a day, if not thrice a day? So of course I have like reams and reams of reports that I could share with you, which all of you, some of them are in the public domain. Policy is very easily blamed, and I heard the usual bogeyman being attacked, APMC. There are 7 states in this country where there is no APMC legislation. Why haven't they developed into model supply chain or value chains have not grown there? Bihar abolished their APMC Act in 2004. It's mayhem out there if you go there. So I don't think that we can blame policy, as Pavnesh rightly said. The cess on fresh produce is never more than 1 or 2%. And I think it can be nobody's case that that is the sort of killer, right? We need to understand that our whole understanding is perhaps somewhere to blame, okay? We put a certain value on grains because there was a political history to it. We were importing it. We had to pay certain costs for that import and that food aid. So the country got together and said, no, from the production to the final supply, we'll create the value chain. So the country created the ecosystem. The research system was created. The marketing system was created. The public distribution system was created. A dedicated credit system was created. Now you look what's happening in FNV. The typical vegetable or fruit farmer has no access to institutional credit, because when we talk about farm credit, our whole policy stance is that this should go only into production of cereals or staples, right? So the majority of, and there are again surveys to prove this, the majority of people who get into fruit and vegetable production are borrowing from the informal market, where the interest rate starts at 36%, and depending on your risk profile may go up to 120%. Certainly no production system that I know of in the world can give you a rate of return to service a loan like that. Then the same goes, it extended to whether you want to access farm machinery, you want to access, specialized services like cold chain, etc. So I think it's not a simple solution like attacking either the government or the private sector. I think there is a major deficit in the entire ecosystem, which everybody will have to get together like we got together in the 60s and solve the core food security problem with cereals. So I'm going to stop here and I'll look forward to some of your comments and suggestions. Thank you.
Thank you very much. Thank you. So we have next one of the authors of the report, Dr. Souvik Dutta, who is assistant professor with ICRIER. So I'll request him, he has already heard these panelist issues. I will request him that he may just wrap up some of the issues or add some issues which Arpita missed during her presentation as she was going very fast.
Which she is always.
So these two issues you can cover and also add your own.
Okay, good afternoon, everyone. Just to correct the chair, I am an assistant professor with IIM Bangalore.
Oh, sorry.
And thanks to Arpita ma'am, who actually thought that I can be capable of be a part of her team to do this and to this study. So I would just talk about a little bit from the survey part. Mainly the awareness thing that came out from the consumers that we surveyed, the 1,000 consumers that we surveyed. Now, as was discussed in this from the beginning, that the awareness about this WHO recommendation, as well as the awareness about the intake of phytonutrients. So to be very honest and frank, before I started this work, I wasn't aware of that, okay? And what is more striking is that, given that the audience that we have here, the panel, that distinguished panel that we have here, the kind of educational background and the financial background that we come from, even these people most of the time don't know about these recommendations or are even not consuming the right amounts. So affordability might not be an issue for these people, but still we are not consuming. So that is one issue. So their awareness has to be starting from the, as our nutritionist told us, that it has to, I think it is very correct that we have to start it from the very primary schooling level, where our kids are. And they are the future and the youth. That, as we find out from the survey, the younger generation is taking the least amount of fruits and vegetables. They are way below the recommended levels. It's almost half the amount of levels that are recommended by the WHO. So that awareness has to start from there, and it has to, so a major, it's not only the government policy has to take part, and as well as the public forums like this and NGOs, everyone has to decide on, to create a awareness about this. And another level of awareness I would like to point out is that the consumer protection rights and the food safety. So the other issue that came up was how do the consumers thought that yes, they said that yes, like around 60% of them told that yes, I'm willing to pay a higher price to buy an organic product. Now the question that came up, yes, if that turns out not to be organic or it was a false claim, where do I go? I don't know. I'm sitting here, I don't know where to go exactly. So that is something which needs to be, the consumers need to be made aware of also. That yes, it's not only an awareness about the consumption, the benefits of consumption, whether you are taking the right amounts or not. That is an awareness that is to be created. And the second level of awareness that needs to be created is that if you are finding something which is wrong, okay, which are not meeting the standards, where do I go? So that is something I think has to be done. And so I'll stop here and thanks everyone for being here. Thank you.
Thank you very much. So we have our panelists have shared their own views. So we have some time, but I will request organizers that we break at 1:30 for lunch because it is written 1:20. So can we do 1:30 break? So we have around half an hour. So what I will do, I will take 2 rounds of questions. In first round, I'll take 6 questions. I'll start from this side, 2 questions from here, 2 questions from in between, 2 questions here, 6 questions in one round. And second time, I'll start from there, 2 questions here, second, then in between, I'll give first round to the panelist to respond, and then second round to the panelist. So from here, I start. Two questions from there. Those who raise hand first, they will get the opportunity. Otherwise, we'll pass to side, give more number here. Yeah. Yes, sir.
My name is Malhotra. I'm just a citizen. A couple of questions for all the panelists, actually. Number one, we're talking a lot about cereals versus vegetables and fruits. I guess we must be talking only about urban citizens because the rural citizen is somebody who probably cannot afford vegetables and fruits, possibly not even proteins. How does he get the feeling of fullness? I guess it's only from cereals. Perhaps the panelists can tell us a little bit about that, as well as gluten intolerance, which seems to be increasing. The next point is, as far as organic food is concerned, there seems to be a consensus that, again, it is the urban consumer who's willing to pay a little extra as far as organic are concerned. What is the percentage of extra that he should pay versus how is the rural population going to be able to pay that extra?
Okay. Second question from this side. Yeah.
Good afternoon, everybody. I have a simple question. My background is from nutrition, and I agree with Ms. Khosla right there. The idea of having phytonutrient as part of your diet is been known quite well, especially in India. But when it comes to supply chain and growth, and then lastly to the customer, how does the idea fit in of getting the right nutrition across? My question to everybody is there a method that you can educate the people in that process? Is there a possible method of doing that so that people know that they are getting the right kind of nutrition along with the food which they are consuming?
Good.
Thank you.
So this, sir.
Hello everybody. I am D.N. Gupta, retired telecom engineer from Ministry of Telecom. My question, one is for Mr. Parvesh.
Close this mic.
Hello. My question, first question is for Mr. Parvesh Sharma. I think you are from MP cadre. And so I think, and you had been most of the time in rural areas or agriculture. So my question basically is from the Bundelkhand area region. And I think most of the people know what is the condition of farmers in Bundelkhand area. Every day, I think 2, 3, 4, 5, 6. You don't have the number of counting. Farmers are having suicides. So what is your experience? Why it is like this? I am from that place. I can explain, but I want your answer.
Very good.
Number one. Number two question is for Vinay Kumar. Vinay Kumar, you are from Bombay. आपने कहीं लिखा है कि आप यहाँ इंडस्ट्री कोई खोल रहे हैं शायद और शुरू भी कर दी है शायद. तो बाकी अभी तक प्रोडक्ट्स क्या आप इंपोर्ट कर रहे थे या यहीं लोकल मैन्युफैक्चर हो रहा था? तो दिस इज क्वेश्चन. एंड जो आपने अभी जो मैन्युफैक्चरिंग यूनिट खोली है उसमें आप क्या प्रोडक्ट्स बनाते हैं और अभी भी कौन से ऐसे प्रोडक्ट्स हैं जो आप अभी भी इंपोर्ट करते हैं?
Thank you. My question one is to Mr. Vinay Kumar, and that's more for a clarification because you said different colors on different days, while all through what we have studied is that it should be balanced diet all the time, and therefore I personally feel it should be, you try to have all the colors on your plate every day. So I need clarification on that. The other is regarding malnutrition, and I personally feel apart from the disadvantageous section of the society, we should worry more about the affluent class today, because all this culture of French fries and chocolates among children, that's picking up. And also, when we talk of pregnant and lactating mothers, I suppose that's something which there's total lack of awareness what they should actually be eating. And another section which we are totally neglecting is urban slums. We do concentrate on urban areas, we concentrate on rural, but then urban slums, perhaps they are the worst affected. You go to any of the construction site and see what that labor class is eating. And what is happening is that by the age of 40, they are unable to work any further.
Okay. So that lady said you will win the next round. I have noted.
Okay. Good afternoon. I'm from Delhi. So my question is to Mr. Sharma and Mr. Kohli. So as consumers of fruits and vegetables, we know that some of these desi varieties of vegetables and maybe fruits tend to stay longer and last longer, and perhaps, though there's a debate about this, have more nutritional value. You know, we've seen that as we cook at homes and store it in fridges or even outside. So, you know, from the agriculture policy space, especially for rain-fed farmers who cannot access high-yielding varieties, is there something that could be done, you know, in your view, in the research space to improve research and innovation into desi or traditional varieties? And secondly, you know, maybe with your startup as well, I don't know how that can work. And also, you know, things to improve, you know, get farmers who probably grow these kind of varieties. I know this is there in the organic space, but can we incentivize these farmers to get their produce, you know, small and marginal farmers, subsistence farmers, to get their produce into this value chain system? Thanks.
There was some last group. Next round, sir, next round.
Yeah.
I have noted. Yes, sir. Yes, sir, please.
So I want to know, Mishi or someone else, the way nowadays we are putting chemical and other pesticide and other things just to improve the quality and preservatives, that is much more carcinogenic. Why not to take care of this carcinogen effect? Particularly this has been found that some of the fruits are they can prevent carcinogenic, they can prevent cancer. But on the contrary, we are putting some chemical, they are creating cancers. So how to prevent it?
So I'll now open for the panelists. I'll give opportunity to everyone. Everyone will be given opportunity. So yes, we can start from, who will start? You? Nutrition, you can start.
Yes, there was an interesting question here regarding fullness and cereals. May I have the gentleman who asked the question? Yeah, okay. So, in fact, just now I was talking to Dr. Kohli and talking about how eating the vegetables and fruits in the right way can alter not only your health in other ways, but also alters your appetite and your palate. And particularly when you eat most of your fruits and vegetables not in a dead form. I can use this word today because it's been used in its absolutely live, native form, which is uncooked. I am not saying don't cook, but I'm saying that do have a certain good amount of a significant percentage of the vegetables and fruits in its most native form, in the raw form, and you will realize how it alters your, and which is why I said carrots, cucumbers, tomatoes. That's a simple, when I say salad to my patients, they get very hassled because somehow Indians are not salad people. We are not known to be associated with salads, and it seems alien. So all I have to tell them is, I want you to consume a carrot, a cucumber, and a tomato daily. That's your challenge. And that's the most important part of your diet. And the first thing I'm here is, when the first follow-up is, actually, we didn't feel hungry. So you can actually go on auto mode, on auto regulation, if you're trying to lose weight, because your body doesn't want anymore. So that element of fullness, I think, seems to be answered with that. And your next question is regarding gluten, and this is the first time a public forum I am going to be talking about gluten as a question from the audience. So I think it's really happening. Awareness is growing, and this will take me a few minutes to explain, because gluten is a toxic protein, is a protein found in wheat, barley, and some other European grains. And in our context, it's essentially wheat and barley, and oats to some extent. Why this protein is being villainized is two reasons. One is what we have, what we call celiac disease. Celiac disease is something which is known for a long time. It's not new. Except the manifestations of celiac disease are very different from what medical doctors and textbooks have recorded all these years, what they have learned. Celiac disease is where the protein in wheat, gluten, destroys the intestines, causing malabsorption, and several other maladies associated now with it, including maybe digestive or extra-intestinal. So you may have celiac disease and you may have no constipation, no diarrhea, no acidity, but you may have skin manifestations, hair loss, autoimmune problems, psychiatric problems, schizophrenia, bipolar, depression, you name it. So a lot of work is now going on in this area, and we are finding in textbooks it is recorded as a childhood diarrheal disease. However, the average age of diagnosis of celiac disease is now 40 to 45 years. So it's an adult disease now. So several neurological problems are being associated with it, and I am working very closely in this area. We founded the first Celiac Society in 2006. It's the National Society, now Celiac Society of India, and largely to create awareness about this disease. However, I have a little more to talk about what we call non-celiac gluten intolerance, which is not celiac. It doesn't destroy the villi of the intestines, but it causes inflammation in the body. And it behaves in terms of its manifestations just like celiac disease. So it could be right from anemia or iron deficiency or vitamin deficiencies to inflammatory conditions, to arthritis, to osteoporosis, osteopenia, anything and everything from head to toe. And that is a grave, I'm seeing a lot of people like this today, including affecting obesity. So there are a lot of links, and I think I have authored a book, Is Wheat Killing You? It's by Penguin. If you want to know more, you can read about it.
Thank you.
But the number suffering from non-celiac is about 7-8 times more.
Good. About urban consumer, you would like to say urban, rural consumers? You also have, yeah.
I'll take 3 of the 4 questions. I think the Bundelkhand question is really outside the purview of this discussion. We can discuss during the lunch. Yeah. But we'll talk about during lunch. I think that would be...
Because you must know what they're growing.
Yeah. So there was a question on the affordability of this category of foods for the rural population. And that's a very fair, I think, question. You see, the last census gave us a figure of around 23 to 24 crore households in this country, right? Of which around 14 crore households are in the rural areas. And of these 14 crore households, around 11.5 to 12 crore households are farm households. So we can reasonably be assured that at least 85 to 90% of these households grow their own food for self-consumption. So whatever, whether it's cereals or pulses or vegetables, the household's own consumption is largely coming out of their own production systems. So I would not say that affordability, especially of the fruits and vegetables segment, is an issue as far as the majority of the rural household. Of course, poverty is a big issue. It's the proximity, and since we do recognize that at the farm gate, these foods are priced at extremely